We are the No Bull Docs. My name is Dr. Jeremy Chlorfine, PhD, clinical psychologist, and my partner?
Dr. Joel Oakner, board-certified cardiologist.
What does No Bull mean? No Bull means we try and take complex medical information and simplify it and make it a little bit more understandable. Joel, why are we holding a 6-foot penis?
I'm glad you asked that. Because today we're talking about erectile dysfunction. This is a big problem. There are 30 million American men with this problem. Now I'm going to give you a stat you didn't know. The average American penis size is 6 inches. Now that means, doing the easy math, there are 180 million inches of wasted, flaccid penis in this country.
We think this is a huge disappointment. And
big problem,
big
Jeremy.
problem for sure. But the serious core issue is that this is a very difficult topic to talk about with anybody, particularly your doctor. We think it's embarrassing, it causes enormous amount of anxiety, and it certainly can mess with your manhood, that's for sure.
And nobody wants to talk about it.
No.
That's why we have to talk about it.
Okay, so first of all, what is the definition of erectile dysfunction?
It is the inability to obtain and maintain a timely erection.
Timely, what do you mean?
Timely is key. Does you no good have an erection in the morning or late at night. You need it when you're about to have sex.
So the question is, getting an erection, how does that happen?
The way people obtain an erection is that the penis has a series of blood vessels that become engorged with blood, and then the penis becomes erect. Much like this. If this is a flaccid, though somewhat pencil-thin penis, this would become an erect penis when it becomes engorged with blood.
Okay, so then the question is that what causes erectile dysfunction?
There are 3 main causes. There are physical or really plumbing issues, there are medicine issues, and also psychological issues.
Okay, so when we talk about physical or plumbing issues, what do you mean?
We're talking about the fact that if you have some diseases like high blood pressure or diabetes or vascular disease, or you smoke, blood vessels that supply the penis lose the ability to become engorged, and therefore you lose the ability to obtain an erection.
Okay, medicines?
Medicines are a problem because some of the medicines we take for common diseases like high blood pressure can actually control your blood pressure, but can cause you to lose the ability again to have an erection.
Okay, so when you have a physical medical issue or medicine issues that cause erectile dysfunction, those have to be treated. But when those things are doing okay, all right,
There's
there's
psychological issues.
going to be some psychological issues. And what we're really talking about is something called performance anxiety. And performance anxiety, the analogy I would use is like in basketball, shooting free throws in practice versus, say, shooting free throws in a game. In practice, you can hit 50 out of 50, but on game day, people are watching, game's on the line, you throw up a clunker, okay? So what we're saying is that psychologically, you're nervous, you're under pressure, and you're not able to perform under those
Yeah, but it's not just bedroom anxiety. It's not just what's going on right
Exactly.
now. It could be something that happened during the day or during the week. It's things buzzing around in the back of your brain. Anything that's messing up your brain, not allowing you to relax and concentrate on what you're doing.
Entirely, and that's a great point. But that actually lends to our treatment. So the thing is, if it's a physical or a plumbing issue, how do you treat that problem?
Look, if you got high blood pressure, you have to work on getting it under better control with diet, with exercise, with changing your medicines. If you have diabetes, get your blood sugar lower, under 100. Exercise. If you're a smoker, stop. And if you have vascular disease, you have to see somebody about that. But if you do that, you will increase your ability to obtain an erection.
Okay, certainly. But then medicines?
Medicines are a little more complicated because we have some medicines that do a great job at, let's say, controlling blood pressure. Beta blockers, calcium channel blockers. And while they do a great job at controlling these diseases, one of the side effects is that you can't obtain an erection. So you need to go to your doctor and say, look, I know my blood pressure is great, but you know what, my life isn't. I can't have sex. And invariably, if you work with your doctor, he or she can actually change your medicines, control your blood pressure, and allow you to obtain an erection.
And so like we said, if those are not the issue, if it's not a medical or a medicine issue and you really have a psych issue, this performance anxiety is a real phenomena. It can be, your self-esteem can be affected, your manhood could be affected, and really what you need to do is you need to treat your stress, you need to treat your anxiety, you need to treat even your depression. But I also think that what happens is your inability to have an erection causes even more stress. So
all right, let's just summarize. So you might have to see an internist, a urologist, and a psychologist. And between those 3 people, we should be able to figure it out, treat it, and rectify the problem.
right, but there's another key issue we got to address, and that's called the Viagra issue, the Cialis, Levitra, any one of those meds.
Huge thing, and because in the short term, look, if you go to your doctor in
Right.
America and you have erectile dysfunction, he or she are going to say, just take this pill, maybe you'll get your erection back. And now that's great, solves the problem temporarily, but here's the problem. There could be something wrong with you. If you can't get an erection, it is really your body standing up and screaming and saying, or not standing up and saying, something's wrong. It's in my head. It's in my plumbing. It's a disease. And just by taking Viagra, you are really covering up a possible problem.
Right, and so really our no bull points are this. Number one is this is very embarrassing, and talking to your doctor about it is not an easy thing to do, and we want to support you. We want to help you do that. Number 2 is there are 3 main causes, okay? A medical, medicine, and psychological. And number 3, if you look at Viagra, Cialis, Levitra as the short term, you may be missing out on the key most important thing is that you may have a life-threatening disease that you're not addressing that you need to. And if you don't, you could end up actually really having serious problems.
If you want more information about erectile dysfunction or other medical topics, please see our website, www.nobuldocs.com.